Hello there. Hi, good morning, good afternoon. I hope you're having a wonderful. Hello there. Hi, good morning, good afternoon. I hope you're having a wonderful week wherever you are, and I hope your day is coming on along well. So today I would like us to talk about depression. This is a very, very broad topic. There's a lot of information out there that it's hard to know what is right and what is not right. So I did some research, and together with the clinical psychologist's help, I was able to get the right information, and I would love to share that with you. So I'm going to split this video into two. So there's going to be a part one and there's going to be a part two. So in part one, we're going to talk about what is depression, how can we identify the causes of depression, what are some of the symptoms that we can use to know that someone or ourselves we're suffering from depression, and then we will also talk about the stages of depression. So that is what we'll talk about in this video, part one. And in part two now, we will talk about how we can self-evaluate ourselves on depression, how we can identify a friend with depression, where can we get help, and what first aid can we do on depression. I'm sure you'd love to know that. So let's get right into the video. Depression is a condition where someone experiences profound feelings of negative emotions, sadness, accompanied by feelings of worthlessness and guilt. So, someone who is depressed will constantly have feelings of sadness. They will constantly feel like they're not worth living, they're not worthy of anything good, and they will constantly feel guilty, probably from the things that they've done in the past. I'm sure you've wondered what causes depression. So one of the causes of depression is genetics. If someone in your family suffers from depression, there's a likelihood that you yourself will suffer from depression because you share the same genes. Another thing is chemical imbalance in the brain, that is specifically in the hypothalamus. There are chemicals in the body that regulate mood. If those chemicals are either in excess or on the lower side, the probability that they will affect the mood in a drastic way is high, thereby leading to depression. Another cause of depression is hormonal imbalance, and this is common in women. For example, after birth, the hormones are normally imbalanced, and this could lead to depression. And that is why you would hear some people after giving birth, they have what we call postpartum depression. Also, hormonal imbalance can be seen by just the normal periods that we experience. You'll realize that there are women whom, when they're going towards experiencing their period, they're normally moody, they're irritable, they have a lot of anxiety, they find it hard to concentrate, they're constantly tired. So that could be one of the causes of depression, hormonal imbalance. Another cause is trauma or stress. Assuming someone has experienced a very traumatic experience in the past, like maybe involved in a grisly car accident, or maybe a victim of domestic violence, what will happen is that this trauma could really infringe on somebody's mental state, leading to depression. Another thing is a personality trait. For example, people who have low self-esteem, these are people who don't feel good about themselves. They are at a higher risk of being depressed because they will constantly have the feelings of worthlessness. Or people who are pessimistic. Pessimistic people are people who are normally negative. There can never be anything right. They normally have negative thoughts. These people are at a higher risk of getting depressed. Other illnesses in the body can also lead to depression. Like, for example, if you're suffering from mental disorders like bipolar disorder, schizophrenia, Alzheimer's disease, these conditions can also lead to depression. And then there are also environmental factors that could lead to depression. Like, for example, if where you live, there's a lot of domestic violence, a lot of injustice, a lot of poverty, a lot of job insecurity. These conditions could really affect your mental state, resulting in depression. What are some of the symptoms of depression? So, number one is constantly feeling down. Like you just feel you don't want to do anything. You're just there, you're just tired. That is a sign of depression. Yeah. Another thing is being irritable and angry. You're constantly angry at the world, constantly angry at everything. You get angry so fast. That is another sign of depression. Another sign is if you've lost interest in the things you loved doing. Like, for example, let's say you loved listening to music, and now when you listen to the music, it's just so boring, you don't want to listen to it. Or if you loved cooking, and now you just don't want to see anything relating to cooking. Or if you loved a certain kind of dress, and now you don't want to see it, it just bores you, everything is boring. That is a sign of depression. Also, if you're constantly feeling anxious about things, that could be a sign of depression. Or if you're feeling worthless, or if you're feeling like you have stomach problems, you're constantly feeling that your stomach is churning and it's painful and it is grumbling and it is very painful, that is a sign of depression. If you have muscle aches, like especially around the neck, it could show that you also have depression. Yeah. So there are a lot of signs and symptoms, but we will continue talking about them along the way. What types of depression are there? How many are they? You're probably wondering. So there are about 9 types of depression that we would like to talk about. So the first one is called major depression. This is also known as clinical depression. Yeah. So clinical depression is depression that has already been diagnosed, and it is that kind of depression where someone feels depressed most of the time, most of the days of a week. What does that mean? It means like since a week has 7 days, in 5 out of 7 days, you're constantly feeling depressed. Then you have major depression. Yeah. Then there's the persistent depressive disorder, that is type number 2. This is a kind of depression that has taken 2 years or longer. In as much as it is being treated, it is there. It has been there. So that is a persistent depressive disorder. Then there's this word that we normally like misusing, bipolar disorder. Bipolar disorder is also known as maniac depression. This is a kind of depression where someone has extreme highs and extreme lows. Like, for example, if they're happy, they're extremely happy that there's nothing that can put them down. But then when they become low, they're on the extreme end of being low, feeling low. There's nothing that can get them out of that. So that is bipolar disorder. Then we have type number 4, the seasonal affective disorder. So this normally happens to people, especially in countries where people experience winter. During winter, it's very cold and they're cooped up in a house because it's very cold. You can't go outside. And the winter might go even for maybe a month or 2, and you don't even get to see sunlight. So this is known as seasonal affective disorder. So someone might end up being so gloomy, so moody, so depressed. And it is basically caused by being cooped up in a closed environment for quite a long time. So it's known as seasonal affective disorder. And when I thought about this, I thought about as like you remember during the lockdown, we were all cooped up in the house and we didn't know what to do about ourselves. We couldn't go outside. And I'm sure most people might have suffered depression during that time. So we can say that they probably suffered seasonal affective disorder. Then another type of depression is known as psychotic depression. Yeah? So psychotic depression is characterized by psychotic symptoms. Psychotic symptoms such as hallucination. Someone is seeing things that are not there, or he's imagining things that are not there, things that are not real. They have the symptoms of paranoia. Paranoia is when someone has this feeling that someone is out there to harm them. That is also a symptom of psychotic depression. Or there is delusion. People believe things that are not real. That is psychotic depression. The sixth type is postpartum depression. I think I had mentioned it before when I was talking about the symptoms. So this one normally happens after childbirth due to hormonal imbalance. Actually, a friend of mine experienced this, where she gave birth and she did not want to see the child, and because the child was young and feeble, she had this constant feeling that this child is he's paralyzed. It was a very awkward state. You can't just understand what's going on. But now that I researched this, I realized that she was suffering from postpartum depression. But fortunately, she got better after getting help. Then we have the premenstrual dysphoric disorder. This is a kind of depression that occurs to women, especially some days before they experience their periods. It is characterized by mood swings. It is characterized by anxiety. It is characterized by lack of concentration. It is characterized by change in appetite. Like, you'll find someone would want to eat too much, or they don't feel like eating at all. It is also characterized by being irritable and angry most of the time. So this one happens some few days before someone experiences their menstrual periods. So this is common in women, yeah? And I think I also mentioned it before. Then we have situation depression. Situation depression is a kind of depression that occurs after a certain event has occurred or a certain situation has occurred. Like, for example, after you've just experienced death of a loved one, you're probably going to suffer from situational depression, yeah? Or if you've experienced divorce, there's a possibility of experiencing situational depression. Or when you've lost a job, or if you're experiencing a highly stressful condition, yeah, you're likely to have situational depression. It is also known as the stress response syndrome. Then type number 9 is the atypical depression. So it is most clinical psychologists don't call it a depression, because it is a kind of a situation where someone is feeling sad, but when a positive thing happens in their life, that condition is improved. So it's a short-term kind of depression, yeah? Like, let's say you woke up feeling so sad the whole day, then at some point, maybe in the afternoon, someone gives you good news and your mood heightens. That is known as atypical depression. So what we've talked about today is just a tip of the iceberg. There's more to come. As I said before, in our next video, we would like to talk about the stages of depression. We'd like to talk about how can you evaluate yourself if you have depression? How can you identify a friend who has depression? What are some of the first aids that you can do to better your depression? And then where can you get help? So stay tuned in and watch the next video, part 2. I'll be waiting. Meanwhile, thank you for watching this. Please do subscribe, share, and comment. This can help someone out there that you know of. Thank you. Have a wonderful day.